Good afternoon. I'm Riza Diaz. This is One News Now. Senators are pushing for the immediate launching of pilot face-to-face classes in low-risk areas. We'll discuss that further with Senator Win Gatchalian, chairman of the Committee on Basic Education, Arts and Culture. Good afternoon, Senator Win.
Good afternoon, Ria. Good afternoon to our listeners.
Riza, sir,
Riza,
how will
good
the
afternoon.
how will the pilot testing be done, and should we base it on the current quarantine statuses?
Actually, apparently, it's based on the quarantine categories. But earlier in the hearing, we recommended to DepEd to expand it to include other epidemiological measurements, such as transmission rates, such as other measures that doctors use. So, aside from the quarantine categories, it has to be scientific based. It has to be. They have to consult the doctors also and experts to come up with a much more accurate risk-based categories.
Senator, has the DepEd presented a plan on identifying the schools that will be part of the said pilot run?
They presented the framework earlier, and the framework is quite simple. No, the framework actually includes only two categories or two criteria. Number one is the quarantine levels, and then number two, if the barangay experienced zero COVID for the last 30 days, then you're qualified to be a pilot school or a pilot area. But we told them that it takes more sophisticated measurements to determine that. So we recommended to employ experts such as epidemiologists, and at the same time other experts that can calculate the risk of that area. And this was confirmed by other doctors who were invited in the hearing, doctors who are part of the Philippine Pediatric Society. So in other words, in short, we recommended to DepEd to come up with a risk-based analysis using other accepted measurements such as transmission rates, such as other measurements, and to determine the actual risk of that area.
Sir, so far, how many nominated pilot schools do we have, and would there be schools from NCR?
The target is about 1,065 schools. That's the target. And those 1,065 schools will start from a recommendation from the superintendent and a concurrence from the local government unit. So in other words, there is a shared responsibility between the superintendent, the school, and also the local government unit. And no, NCR will not be part of that, or any GCQ areas will not be part of that.
Senator, finally, what are your suggestions regarding safety protocols? How can we ensure the safety of the students and teachers?
There's no compromise to safety. Government needs to invest in health protocols in the schools. So, for example, hand washing facilities, alcohol dispensers, PPEs, these should be supplied by the schools. But on top of that, the local schools or DepEd in the regions should also make sure that there is the framework, or the framework for response is also there. So, for example, if something happens in the school, for example, one teacher gets contaminated or one school official gets contaminated, they know how to respond, they know how to call, and there is ample support to give in terms of treatment and hospitalization if need be.
Sir, since you mentioned that, what's your reaction to the proposal to include teachers in vaccine priority list?
They should be. Teachers should be included teachers should be included in the priority list. They should be considered as a frontliner, although in education. And a lot of countries has been doing this. There are more than a dozen countries have categorized their teachers as frontliners and included them in the priority list. So education in many countries is viewed as an essential service from the government. In fact, in the whole world, there are only 14 countries that have not opened schools. The Philippines is included in that. But here in the region, in Southeast Asia and the Pacific, it's only the Philippines that has not opened school yet. So we're one of the few, actually, countries that have not opened school yet. So in order to open school safely, you have to make sure that our teachers are protected. And the best way to do that is administer the vaccine to them.
Well, thank you, sir, for your time and your insights. That's Senator Win Gatchalian. Meanwhile, the Health Department confirmed another case of the South African variant in Pasay City, bringing the total number to 4. Let's discuss that with Dr. Jean Solante, infectious disease head of the San Lazaro Hospital. Doc, good afternoon. Can we attribute the rising COVID-19 cases in Pasay to a threat of the South African variant?
Yes, I think it's not too far to say that, no? But again, we need data that it's really the variant, but it's a possibility. I cannot totally rule that out. And the fact that this is a localized surge of cases in Pasay only, and those 3 cases were also documented in that particular area, the more that we need to be careful now at this point in time.
Doc, what's your reaction to the Department of Health's recommendation to allocate more vaccines for health workers and even residents in Pasay?
I think that's the best option that we need to do now. The more people vaccinated in that area, the lower the transmission rate, the more protection, more immunity developed within a period of time. That can really help in terms of controlling the pandemic. Not necessarily, not the impact, not maybe in the next few weeks, but that's a good step in terms of how we will go about in this pandemic.
Mm-hmm. So do you suggest placing the city under ECQ or MECQ?
Well, that's up to the IATF. There are guidelines to do that, especially in terms of the number of cases reported in a day-to-day, the threshold, and the reproduction number. That will always be a possibility also.
You mentioned, sir, the IATF. Should the government rethink the gradual easing of restrictions in its entirety, as now that we have, the threat of the South African variant?
Yes, we always emphasize that in terms of gradual easing of the what we call lockdown, or increasing the capacity of most of this establishment. But since we now have the vaccine rollout, it's really a matter of increasing the confidence in vaccine, and at the same time, don't forget that we need to still follow the minimum health protocol, safety protocol, for us to really compensate and mitigate this pandemic.
Doc, what can you say about the reopening of cinemas and museums in GCQ areas starting March 5?
I always emphasize this, that these are areas that are high risk for transmission, being in closed spaces, and at the same time, what is crucial here is that they need to improve the ventilation of these areas. And if they're going to improve the ventilation, they also need to be strictly traffic the number of people inside that particular area.
Doc, today is the 3rd day of the vaccine rollout. When are we going to feel the effects of the inoculation? Will it reflect on the numbers?
It's a difficult question because we are only vaccinating the frontline healthcare workers, no? And vaccinating this population may not necessarily be affecting the herd immunity or the benefit of a herd immunity, because for a population to get the herd immunity, you need to vaccinate 50-60% of the total population. The objective of vaccinating the healthcare workers is protecting them so that any surge of cases, there will be people who will be taking care of the COVID-19 patients.
Well, thank you for your time, Doc Jean Solante of the San Lazaro Hospital. More healthcare workers at the Philippine General Hospital have expressed willingness to receive a Sinovac vaccine. In an interview with the Chiefs, PGH Director Gerardo Legaspi said 480 employees were inoculated yesterday, higher than the 128 on Monday. Legaspi said vaccine hesitancy among PGH workers slightly improved after a town hall meeting with health experts and officials.
We still try to convince as many people as we can. You knew about the negative comments and the protestations against it. And we had a town hall meeting last Saturday and attended by all the experts and DOH officials. And I think it had a good effect also.
Now here are other vaccine stories from around the world. The Gavi and World Health Organization-led COVAX facility will deliver 237 million doses of AstraZeneca jabs to 142 countries by the end of May. COVAX shipped out the first batch of vaccines to Ghana and Ivory Coast last week. Thailand Prime Minister Prayut Chan-ocha has ordered to study the possible issuance of vaccine passports to international travelers. Several countries are looking at introducing vaccine passports as part of the efforts to boost tourism. And in Saudi Arabia, the health ministry says only people who have been vaccinated against COVID-19 will be allowed to attend the Hajj this year. Last year, Muslims abroad weren't allowed to take part in the rite as the kingdom reduced the number of pilgrims to just 1,000 to help prevent the spread of COVID-19. And for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.